Hi, welcome back to another World Cancer Day live.
We're going around the world for the 5K challenge for our 2023 Close the Care Gap campaign.
Yeah, where have we been today? We started in South Africa.
We've been to Nigeria.
Then Taiwan.
And Argentina.
Yeah.
And now we're traveling.
Now we're going back to Jordan. So I think the loop has been more of a
crisscross,
a squiggle. Yeah. But that's
ultimately
okay.
make it around the world. So that's
yeah.
good.
And we've seen some really incredible things: dancing, running, walking. Yeah. And then even those who haven't been doing the 5K have been doing some really nice things on social media.
Yeah, so now we're going to go to Jordan and speak with the former president of UICC, the Union for International Cancer Control, who leads the World Cancer Day campaign. Should we connect in?
Yeah, definitely. Let's see if she's there. Princess Dina.
So yes, we'll be joined by Her Royal Highness Princess Dina Mired of Jordan, who is the former president of the Union for International Cancer Control, also former Director General of the King Hussein Cancer Foundation, which she helped establish. She herself knows a lot about cancer. Her son has had cancer, and an amazing advocate, always amazing words, heartfelt words to be said about it, and just, advancing the cause of cancer control around the world. Thank you so much for joining us today, Princess Dina.
Oh, I'm so happy to join you all.
It's really great to have you here. So you're in Amman, correct?
Yes, I am. Yes, I am.
And how's your World Cancer Day been?
This World Cancer Day, first of all, I would have loved to do the 5K challenge, but the weather was not permitting, unfortunately. But I'm so proud of this initiative because not only it encourages people to physically do the 5,000K, but symbolically it sort of symbolizes people moving together to close the cancer care gap. So I'm so happy to be, about this initiative, and I promise you, I will be doing a 5K as soon as the weather permits.
Yeah, definitely. Yeah, and everyone can do it after World Cancer Day as well. There's no time limit, and you can do 5K. You can also do 5,000K if you want to. That's absolutely fine.
Continue to tag 5 people, donate whatever amount you can to a local charity to help the cause. Let's keep it going throughout the year.
Okay, and let's talk about what you have been doing.
Yes, because no doubt you've been very busy, I'm sure.
Yeah, although you haven't been doing 5K.
Actually, I'm sort of busy all year round trying to close the care gap. I try to do my best to support various NGOs all over the world with whatever is in my capacity. So that's one. But of course, World Cancer Day, it's a day, I suppose, for everybody to share what they've been doing. So what I've been doing, on the one hand, I've been as patron also now of the European Organization for Research and Treatment of Cancer. I've done a Gulf tour, visited 4 countries in 8 days, did so many meetings with all the stakeholders, because we're trying to give access to cancer clinical trials to our region. So in that, in this way, we are trying to give access to our patients in our region who have long been denied the chance to join these life-saving cancer clinical trials. So that's one, and that's good news. Where it's the start, but it's my new mission to help make that happen. But also, I also feel, we talk about closing the care gap, and that's fantastic. But I also feel we need to close the destructive practices of the industries that harm our health. So in that regard, I've also just done a retreat with 15 NGOs who are fighting tobacco in Jordan. We've done a retreat a 2-day retreat at the Dead Sea, trying to see how we can improve our efforts, scale up our work, scale up our voice, to be able to fight the industry that's working super hard in Jordan to keep our children and people addicted to tobacco. And so it's so important, you know, one can work on two fronts. First of all, of course, working to close the care gap, but also to stop the industries, you know, whether the alcohol industry, the food industry, the tobacco industry, who are always working against all our efforts to save people. They are the ones who keep churning on more cancer patients and more NCD patients. You know, as we are struggling to give access for people for treatment, you know, they keep bringing us more people and more patients.
You're right. Yep, over one third of the cancers are caused by these products, tobacco, alcohol, and ultra-processed foods that lead to obesity. And I know you've done a lot of work in getting the Jordanian government to enact some policies that can help people limit their consumption, limit their exposure to these products.
Yes, and to be honest, it's such a big battle. It's an uphill battle, but we're not giving up. And we are going to just continue, you know, building ourselves to become a real solid pressure group that will not be ignored. And this is what we are doing as much as we can, because there's no point of having an amazing cancer center that treats patients, which is great, of course. But if we don't stop the tap, if we don't close the tap of the tobacco industry, adding 30% more cancer patients, you know, to the scene. And so that's always also very important to, you know, help people become more aware of. And I have seen the press release of UICC, and it's definitely taking a stand on that. You know, these industries do all their harm, they pocket all the money, and then they leave the side effects, which are not side effects, they're main effects actually, leaving it to governments to have to deal with the aftermath of consuming all these toxins and all this carcinogenic stuff.
And it's true when it comes to tobacco and alcohol and ultra-processed foods, a lot of times put the onus on the individual, and it's stigmatizing, when actually a lot of things that governments can do to help the individual lead a healthier life, and of course to constrain these commercial interests a bit driven by industries that want to sell their products.
Yeah, exactly. Exactly.
Well, thank you so much for those efforts.
I think we actually have a question here that says, what would you suggest governments around the world to do to help their people in the fight against tobacco? So yeah, if you could speak to the government or any government now, what would you suggest?
You know, governments should, first of all, you know, the ultimate is to raise the price of the cigarette, raise the price, and of course raise the tax. And by this way, it's a triple win, because then they will have more money, for example, to target other health reforms that they need to do, for example. And then the cigarettes will become less accessible to young people because they are much more expensive. So it will stop future customers, as we say, and at the same time, you know, reduce the number of current smokers. So it's such a triple win. And I tell governments, you know, yes, you get the money from the tobacco industry now, but you are really paying double in the years to come. So it's not a good investment at all, and in many levels. And the time has come to really take stock, because, you know, we are, at least in Jordan, we have such high rates of tobacco. It's as if there's an investment to make our people sick. And you know, very soon it will be unsustainable. There's no Ministry of Health in the world will be able to cater for all the sick people who are going to be sick, not only from cancer, but from other NCDs as well.
Yeah, and sometimes the tobacco industry can exert such influence on the government that policy measures are difficult to enact. They get involved in the actual decisions on health and everything. We can even see that here. And I know you're heavily involved in that in Jordan to help move some of the dial there. Can you tell us more about that?
Yeah, I mean, the problem is, you know, these industries, they prey on governments, you know, whether powerful governments And certainly they prey on governments who are financially challenged, because that's when they dangle those sort of immediate dollars, so to speak. And, you know, we've seen even powerful countries like Australia, Canada, they've taken them to court and so on and so forth. And it was a big battle. Of course, they won, thankfully. But, you know, it requires a lot of resources, which these countries have. But unfortunately, when they do come to countries like ours, who are currently economically challenged right after the Arab Spring, right after the Syrian refugees, right after the Corona, and now the Ukraine war, etc. So governments, even with the best of intentions, right now, they're not able to stand up to them. And this is what they do. And certainly they are looking even to Africa. You know, historically in Africa, smoking rates are low because, you know, the average person did not even have that $1 or $2 to spend on cigarettes. Now they're looking for Africa as African countries' economies are moving up. So it is so criminal what they do. And yeah, they enter, they bribe people. They have PR people to sort of enter with governments. They even sit, imagine, on the boards of the entities that actually decide what goes into a cigarette. I've seen that in my own eyes. It's terrible. The government, you know, they interfere in government policies in their sneaky ways. And so it's been really, really tough. But we've decided here in Jordan that we want to up the ante in terms of our voice to become a really present and sustainable pressure group that soon will become difficult to ignore. So this is why we had our retreat, and you know, we will never give up. So that's, you know, for one, but it's certainly an uphill battle, because as you know, tobacco industry is just about big business, big money, unfortunately.
And in all this work that you're doing, where do you see the link to the campaign theme, Close the Care Gap? What disparity do you see?
Yeah, because when, you know, you close the care gap by also reducing the number of patients. You know, when you stop these industries that harm us, you reduce the number. I mean, already we have a young population in many of low middle income countries who are growing. And as you know, NCDs and cancer sort of appear more as you grow older, right? So we need to stop those industries who are responsible for 40% of NCDs. Imagine if we can reduce that. So that's one, you know, and so that's a big part of closing the care gap. What's the point of, even here in Jordan, like I said before, we have an amazing cancer center, thankfully, that can treat and save lives, but the tap is open. You know, these industries are intent on owning the lungs of our youth. So that is why lung cancer is #1 in our country. It's not a coincidence at all. So imagine if we manage to defeat tobacco, we can reduce cancer cases by 30%. And this goes for everywhere around the world. And of course, other MCDs. It's not just lung cancer, and it's not just a third of cancers. It's diabetes, heart disease, respiratory illnesses, and so on. So that's one. So I think, you know, the time has come to keep talking about fighting those industries who are just making money at the expense of our health.
Yeah, they do. And they also tend to prey on populations already very vulnerable, lack you know, the information necessarily, or don't have other means. So thank you so much for that, Princess Dina. I don't know if you have anything else you want to mention.
Yeah, I'm just going to say well done and good luck. And I hope, and I'm so happy to know that everyone around the world is moving, literally, moving symbolically, but moving literally to showcase their support for all of us, to support cancer patients and to stop new cancer patients happening all over the world.
Well, thank you so much
for your time. And
Take care.
have a great evening.
Bye.
Bye, Princess Dina. Bye. Well, I think that was,
I mean, yeah, it's insight from somebody who's working at the highest levels and really we know between on the ground with patients all the way up to policymakers. So that was great.
yeah, definitely.
Where
Okay.
are we going next?
Well, next, I think we are going to Lebanon.
Lebanon. So we'll be joining with the Children Cancer Center of Lebanon in a couple of hours.
And they will be lighting a national monument, national museum. They're going to be able to tell us a lot more about it. And yeah, we'll be able to add them to our growing map as well.
And when will that be?
That will be at
6.
5.
we'll be posting this at 5:30. That's right, 5:30. So in 2 hours and 15 minutes. There we go.
Yeah, we look forward to there. And it's not too late to do your 5K challenge. You can still win the hoodie. We'll be giving out releasing the giveaways at the end. So yeah,
Great.
see you there.
Join us soon.
Bye.
Bye.